Happy Monday, everybody, and welcome to the Go Wellness Practice Accelerator Challenge webinar. So we're so excited to have the amazingly talented Dr. Dan Kellams be teaching today. We're going to be talking thyroid health. But to get started, I wanted to talk about session 1. I actually have an agenda now, so I'm going to share my screen and show you, babes. I just kind of wanted to go over what we're going to be talking about. Session 1 is February 25th and 26th, so if you have not registered, please do so. We've only got, like 4 seats left for live. So if you don't register soon, you're gonna have to just attend virtually, which is way less fun. So we've got some great topics. We're gonna talk about new profit generation or generators in your lab packages, cell core, all kinds of good things. Strategic influence, we're gonna have Michael Burnoff in-house. He's a really, really fun speaker, communications professional. We love him. So we're gonna be talking about some of our new workshops that we're delivering. Dan's going to be talking about a lot of awesome stuff throughout the weekend. Biotoxins, cell danger response, inflammation, glyphosate. I can never say this word. Glyphosate. Yeah. So he's going to be throwing down some good stuff on that. We're going to be talking new peptides. We've got Dr. Eckel, who's going to be talking about like the original bioenergetics with the Emperor's Quest for Immortality or Immortality. Not immorality. So it's gonna be super awesome.
I like immorality.
I know, immorality. No, we're gonna be talking 60-day pain reset, which is a new patient like hack program we've launched that's going super well. We'll be talking about weight programs. We'll have Michael Caruso from BPI in talking about psychology and the physiology in sports athletics and how to enhance yourself with peptides. So that's gonna be cool. So, overall, it's going to just be a really, really great event. We're super excited about what we're delivering. We're super excited to see you. For those of you on here now who have not confirmed attendance, please do so. It makes my life so much easier. Awesome. Well, Dan, let's kick her off with some thyroid magic.
Sweet. Well, welcome everybody. I want to jump in. I know I'm sure that, there's quite a bit of stuff when it comes to thyroid that everybody's read, seen, talked about, been putting together, doing for their patients, So I think there's a really big difference in what we learn, either in a book or conference notes versus what we find in the clinic and what actually works. So I kind of want to put that together a little bit and kind of break these things down. It's really interesting, when we're looking at the pathway, and one of the biggest misconceptions, and you'll hear this time and time again, is that the main thing that, the conventional medical model will look at is TSH and T4. And the problem with that is it's a very short picture, and that's pretty much the feedback mechanism. The brain, pituitary release TSH, that'll stimulate the thyroid to make thyroid hormone, and a majority of what the thyroid makes is T4, and that's the biggest negative feedback loop. It's like, okay, as long as T4 is good, the brain cycle looks normal, and the doctors are going to say no thyroid issues. But when we say hypothyroid, maybe it's a change of vocab or what we're saying. It should be thyroid hormone metabolism. One, that appeals to my inner geek, and so it's way sexier. But 2, it's more accurate, because there's so many processes that have to go, that lend itself to this process of building up thyroid hormone. And you need thyroid hormone from everybody and for every cell. So I think it's a critical piece. I'm looking at your chat here. I try to see everything. Oh, Annie's sending a welcome chat. So I want to make sure that if there's any questions that I answer those. And I may get some in-house questions from my own staff. So if that's the case, we're going to talk about it. So brain tells the thyroid to do its job, right? And sometimes that's low. You get thyroid releasing hormone to thyroid stimulating hormone. That's hypothalamus to pituitary. So you have to think about that right there if TSH is low. Now, for diagnosing hypothyroid or hyperthyroid, pretty much the standard is, what's that TSH? If it's high, it's hypothyroid. If it's over 4.5, if it's under 0.4, then, or 0.5, it's considered hyperthyroid. And that just doesn't give us the full picture. So we have to look at everything. So if TSH is low, it's good to ask, has there been any brain trauma, right? Head trauma, car accidents, too much head banging back in your Metallica days, things like that. Maybe you go back even further. Maybe you're a deadhead and you're literally now a deadhead. There's a difference between microdosing and recreational dose, guys. So, that'll destroy the pituitary and the hypothalamus as well. So, maybe output is coming from brain trauma. So you will see this. And it's a really unfortunate situation with neurodegenerative diseases, right? Is that the brain can no longer properly work or the feedback mechanisms are disrupted. So that's that first piece, the brain telling the body and the thyroid to do its job. And speaking of inflammatory process, and this is my plug of anything that's going to disrupt any hormone pathway, is just like when we teach in our functional training that we're doing tonight at 5, we always start with inflammation, because inflammation will disrupt all metabolic processes. It disrupts the mitochondria. It damages hormone receptor sites, but it disrupts the body. It causes the body to go into a stress response. So inflammation, stress, and insulin that's your top things right there. So we need to be looking for those. First, we identify those. But let's say those are good. Let's go through this pathway. So the brain tells the thyroid to do its job. So the thyroid gets to work. Now we're going to do a little bit more of a deep dive than regular. This isn't just saying, all right, the thyroid's going to make 90 to 93% T4 and about 7 to 10% of T3. And the bioactive form of thyroid hormone is T3. And it makes sense why it would set up this way. The thyroid is going to make, a bit of thyroid hormone that kind of needs to be processed throughout the day, so you get a trickle effect. Because you don't want a mass surge of thyroid hormone, you want a trickle effect, right? It's like I refer to it, and I know we've talked about it at Go Wellness, and Michelle Miller, she's talked about it so much, and she loves the analogy as the coffee bean, the coffee process, and that's pretty much what we're looking at, right? The thyroid produces basically like a coffee bean. And it produces a little bit like a shot of espresso in the morning. That's at T3. So then we get this slow drip of coffee throughout the rest of the day, and that's done through the brewing process that is combined between liver and gut function. That's majority 60, 80%. But what happens in that thyroid? What's actually going on in there? Well, you need these precursors. So what happens is the body has to bring in iodine, and it does that through a sodium transporter. So you need good sodium levels. So you're going to bring in iodine. It's going to be oxidized to iodide, or did I say that backwards? Is it iodide to iodine? Mm-hmm. Yeah. So that oxidation. So you have to pull that in. So you got this sodium symporter, and that brings in the sodium in your iodine supply. And so it goes this oxidation. And the oxidation is triggered through the TPO, the thyroid peroxidase. And then that goes into the colloid, or the central hub of the thyroid. And this is kind of like the oven. This is where we're going to bake it. And this process is really important, because what we're going to do is we're going to take the iodine, we're going to take thyroglobulin, and that's this protein that everything is built upon. And so we're going to lather that thing in some tyrosine residue, and that's so the iodine can stick to it. So we stick the iodine to the thyroglobulin, and that is another role of TPO, thyroid peroxidase, and that's called organification. So we organify this process, and then the chemical process that then occurs is called coupling, and that coupling brings together the tyrosines and the iodines, and we end up with T3s and T4s. There's going to be a little bit of T2s and T1s in there, and those are recycled, but the T3 and the T4, that's how it's made, and then that's pulled back out. Now, what's interesting is when the oxidation process occurs on iodine, that is, we're going to get some peroxide. And we need selenium to make sure that peroxide is not going to get too high, or that can create some damage to the thyroid or disrupt the process altogether. But we also need good water. We need good oxygen. We need good H2 in there, H2O. Nothing like some good old H2O, right? what's Water Boy say? That's some high quality H2O. So we're getting the H2O, we're pulling that in, and we're working this process, right? And then we got to pull that back out. And if TPO is being damaged by thyroid peroxidase antibodies, well, we can't get it out. So that can accumulate in the thyroid. So it just builds up and builds up and builds up. And that's what typically will create nodules on the thyroid. So there's a lot of research shows that the selenium pathway and this inflammatory pathway by itself can actually create Hashimoto's. So people that have actually done high dose selenium have a large percentage of them actually reduce and almost seem to wipe out their Hashimoto's. So it's really an interesting thought. You know, it's less than 30%, but it's really interesting that a high level of people just lacking selenium causes like hypothyroid or Hashimoto's type process to happen in the body. So it's crazy. But we got to get those nutrients. So we get the T4, T3, and they go into circulation. Those are going to be carried by thyroid binding globulins, but the majority of the T4 is going to go to the liver. This is where things get really interesting, because that we have three major pathways in the liver to convert that T4 to T3. Now, this goes, before we even get there, this is super important to talk about all the hepatic bile transformation pathways, or AKA liver detoxification pathways. It's just detoxification doesn't even begin to describe all the crazy shit that the liver does. I mean, it just does a lot of stuff. So before, some high quality Americano right there. So before we can even get into this process, we have to make sure the liver has what it needs. And that's why I say, like, when you're putting this stuff together and understanding thyroid, you gotta have an idea of physiology through the whole body. So the first major phase of liver process is dependent on an enzyme called cytochrome P450. And the chrome inside of chrome is not like polished rims on your car. It's iron, okay? So you got to have that iron. Anytime you see chrome or CYP, that's always a cytochrome-based enzyme, and you always need iron for that. So if you have someone who's anemic, they could have problems in this pathway. So we need this cytochrome. So that's this phase 1 hepatic bile transformation. Phase 2 is like 6, and now these things kind of overlap. So it's not as easy as saying, well, phase 1 and then phase 2, they get kind of overlap. But phase 2 has 6 major pathways. And I use the acronym SMAG because, well, that's just how my brain remembers shit. So sulfation, so we need our sulfurs, our sulfur-based vegetables. And you'll know a lot of the stuff that we talk about in here require sulfur. And sometimes people have sulfur sensitivities. And usually those people have a glyphosate accumulation. Just so you know, little clinical pearl there. If somebody has an issue with sulfates or sulfurs, they typically actually need more, but they have a sensitivity to it because the way glyphosate has disrupted sulfur absorption in the gut. You go certified organic there. So you need your sulfur. So you're going to get that through your cruciferous vegetables, right? Sulfation, the M, methylation, all right? So this is going to be your methyl donors, like your B vitamins, your B12, your folate. You need these things so that you have this particular pathway where you're throwing those methyl donors on there, and about 90% of methylation occurs in the liver. So it's a super important process. So then we have acetylation that's used in your acetyl groups. You need a lot of acetylcholine for this. Choline, strangely enough, is a good methyl donor. It's one of the top methyl donors. You need amino acid conjugation. That's all these amino acids that your body uses. So you need make sure that someone's getting good proteins and a good array, good source of proteins to help with that. You need glutathione. Now, glutathione is a sulfur-based protein. It does require B vitamins as well. So you got your methyl donors, right? So you need that as well. And you have glucuronidation, which is its own pathway, and you get that from like the precursors for that. You get it from grapes, you can get it from green tea. You get it from fish. There's a lot of different things that supply these pathways.
Hey everybody, Reagan Archibald here. I hope you enjoyed the Go Wellness show and maybe learned a couple things you could apply to your practice. If you're a healthcare entrepreneur who wants to work in an academic think tank with like-minded humans who are just like you, looking to provide better service, better quality of care for your patients, reach us at info@gowellness.com and we're happy to do a free practice analysis for you.